everyone. Today's session is on how to perform well in the university exams. Okay, this is for the final year students. I take the session every year, and I hope it does help in some way. This is basically a compilation from my experience both as a student and as an examiner. All right, so I will just give, it's a very brief session, 10-15 minutes, and it's just to direct you in the right direction when it comes to writing your professional exams. Okay, so this will go on YouTube. So those who've missed it can watch it on YouTube also. Do subscribe to the channel, like, share, comment. Okay, so we always say you should study hard. All right, so but I say you should study smart. Okay, you should study. I'm not saying don't study hard. Okay, so there's no shortcut to success. There is absolutely no shortcut to success. You have to study consistently throughout the year. But because of the circumstances that we've been in, I'm talking about COVID, it's very difficult to, it's been a very difficult last 2 years. So how do we improvise if we've not been able to maintain that continuity in studying? We have to study smart. Okay, so studying smart means knowing what to study. You can't just sit 1 month before your exams and open up all your books of all your subjects, your Harrison and your Davidson, or in Obs and Gynae, whatever books you're reading. You have to study smart. There is very less time now, so you have to focus on what is important and how you can score well. Okay, so your goals should be specific, measurable, attainable, okay, relevant and time-based. You have to see how much time you have on hands, make a timetable. All right, stick to the timetable. That means your goals should be attainable. All right, and study what is relevant. Don't go and study some rare things at this time. All right, so study smart. Don't waste your time on unnecessary things. Now, quickly, briefly, the MCI, I'm talking about Obs and Gynae here. Okay, OBG is what the emphasis is on. But of course, the tricks I will tell you, you can apply to all the subjects. So the OBG paper, as per the MCI, is divided into a theory paper and a practical paper. I'm just giving you the marks distribution. Many of you may not know this. It is important to know so you know where to target your efforts towards. Okay, so the theory part has a 40 marks paper 1 plus a 40 marks paper 2. This is a total of 80 marks. All right, the logbook is of 10 marks. Internal assessment theory is of 20 marks. Table viva obs and is 10 marks, and table viva gynae is 10 marks. So remember the table vivas. This is your usually afternoon viva. In many colleges, they're called afternoon viva. Some colleges, they're called table viva. Usually they're held in the afternoon after the main case presentation. So remember, these are not added in your practical. They go in your theory exam. All right. So paper 1 is usually your obs paper. Paper 2 is your gynae paper. But of course, I don't know how it is. Some medical colleges I've seen or I've worked in, usually they interchange the questions also. All right, but usually paper 1 is obs, and usually they add social obstetrics here. That is maternal mortality, preventive, social medicine. All that also comes in paper 1. Paper 2 does include a bit of family planning, family welfare. So you may get the questions may be interchanged, but usually this is what is done in most universities. Paper 1 is obs, paper 2 is gynae. Logbook. I'm sure most medical colleges have this. Wherever I've worked, there's always been a logbook. This goes in your theory. Internal assessment theory is 20 marks. Table viva, as I said, goes in theory, not in practical. So this adds up to a total of 130 marks is your theory. Okay. It's also important to pass both in theory and practical. Okay. So you have to pass in both. Practical marks, you have a long obstetric case, which is 35 marks, and you have a short gynae case, which is 15 marks. And you have your internal assessment, which is 20 marks. So the major part of practical exam is your long obstetric case. This gives a total of 70 marks. So you have a gross total of 200 marks. Okay, so this is how your paper distribution is. All right, so seeing this, you already know this has already gone probably, internal assessments. Now your main focus should be on the other things. All right. Okay, so paper 1, as I said, is obstetrics, including social obstetrics. Paper 2 is gynecology, including family welfare. Here also a bit of neonatology may be asked. Okay, and this is in most universities. It may differ from college to college, so I'm just generalizing it. All right. And then the obstetric table viva. So I'm talking about theory. Internal assessment and logbook is separate. The obstetric table viva consists of pelvis and skull, the obstetric instruments like forceps, vacuum, specimens, obstetric specimens. You'll have specimens of anencephaly. You have specimens of placenta, of twin pregnancies. Those are the common specimens. Then you have obstetric drugs like oxytocin, the prostaglandins. All right. Then you have partograph, and then we have CTGs. This is usually what is asked in the, or what is kept on the obstetric table viva. And usually out of these 6 things I've mentioned, usually a student will be asked any of 3 from these. And pelvis and skull is definitely asked. Okay, so pelvis and skull is the most important part of obstetric table viva. Every student will get quizzed on pelvis and skull, some aspect of pelvis and skull. So that's a very important part. The gynae table viva has instruments, drugs, contraceptives, and specimens. Specimens, usually we have fibroids or ovarian malignancy or ovarian tumors or cervical cancer, endometrial cancer. Usually those are the specimens which are kept. Okay, so again, out of these, you will be asked 3, I think you have one more. Yeah, HSG films may be kept. Okay, this again depends on college to college. Okay, so where I work in ESI Medical College, we do have HSG films also. So this is what is kept in the gynae table viva. So this is your theory pattern for the theory exam. Okay, practical clinical exam, the most important 35 marks is the long obstetric case, which is a bedside case. And the viva is also usually bedside along with the patient. The patient is, you're supposed to examine the patient in front of the exam, show your examination in front of the examiner, is what happens in most medical colleges. So this is the most important part, long obstetric case. It's very important. Okay, then this is usually 90% of the times it is an antenatal case. All right, but sometimes we do fall short of cases and some people may get a postnatal case. Okay, in case cases fall short, but usually 90% will get an antenatal case. What are the case histories we ask? Okay, it could be a normal pregnancy with absolutely no complaint. One day before the exam, everybody admits patients. It could be a normal patient also, but we try as much as possible to give some complaint, to give a patient with some complaints. The common ones are anemia in pregnancy, hypertension in pregnancy, diabetes in pregnancy, and Rh negative pregnancy, fetal growth restriction, multiple pregnancy, previous LSCS, post-dated pregnancy, bad obstetric history or recurrent pregnancy loss, and oligohydramnios, polyhydramnios. Okay, so this is the list of cases that are usually kept in the exam, and this is applicable to all medical colleges. All right. Postnatal case could be a post-vaginal delivery or post-cesarean delivery, as I said. So what is important to know is your history taking in and examination in a postnatal case. So don't forget to revise this when you go for your viva. Don't forget to revise how to take a postnatal case. Many of you get a case and then you start fumbling. What should you do? What is the order? How should you ask? Okay. So postnatal case needs to be revised. Also, don't just concentrate on antenatal cases. Okay, they may just give you a postnatal case. That's what's important. Write down this list. These are what the common case scenarios that are given. Okay, then coming to the short gynae case. Now, this again depends on which medical college you're from. Some of them where I've been, we actually get a bedside case is given. Okay, but in some colleges where I currently am, we just have a short case scenarios are pre-prepared and are used as a basis for asking and discussing different scenarios. So we have a case of fibroid with menorrhagia, or we have a case of postmenopausal bleeding, or we have a case of AUB, or we have a case of mass per vaginum. And based on those case scenarios, we lead the student and we ask different questions based on that. So that is how it is done in most Delhi medical colleges. I know it is done like this. Where I'm working, ESI Faridabad, also it is done like this. In the south, bedside cases are given. So again, it depends on where you're from. I'm just giving you my experience from where I've worked and where I've done my MBBS PG from. You can get a bedside case or you may get a pre-prepared case. Okay, either way, you need to be prepared. This is based on where you are studying from. Okay, Now, coming to how do you answer well? Okay, I know most of you must have been waiting for this part. So as I said, there is no substitute to studying, but instead of studying hard, you need to study smart. Okay, you need to study hard also, but you need to study now very selectively. Okay, you study smart. Okay, also don't study because you have to. Okay, make studying a habit. We are in such a field that this is just the beginning of your careers. You have to study every day. Okay, especially if you're in a field like I am, where I am teaching most of the time. You have to study, even if you're not, even if you're in any other field. You have to. Knowledge, things change so frequently. When I did my MBBS 20 years back, things were so different. Okay, obstetrics and gynae, when I did 10 years 12 years back, so such vast changes have happened. If I had not been studying continuously, I would be in a mess, because things change at such a fast pace nowadays. So make studying a habit. Okay, study because knowledge is power. Study because it can never be taken. Knowledge can never be taken away from you. Study because you want to know more. Study because it enhances you. Study because it grows you. Okay, this studying should become a habit. Okay, it should not be just because the exam is around the corner. Make studying a habit. Okay, this is very essential, because now you're going to be studying for your NEET PG or USMLE or whatever, and then you're going to, once you're a PG student, you'll have to study. Then once you're a resident, you'll be giving fellowship exams, super specialty. It's a constant process. So if you make it a habit, you won't have that pressure ki ab exam aa raha, now what do I do? Okay, so but there are some tricks to score higher, and I will tell you what those are. Okay, so as I said, be smart. Okay, so this is the theory paper. Let's talk about theory paper. Attempt all the questions, even if you have no clue about some question which is asked. Okay, say question aata hai COVID in pregnancy. You have no idea. Just write whatever you know about COVID. Don't leave it blank. Don't write one sentence and leave it blank. And I'm not saying make up answers. Just write something which is relevant to topic. I'm sure you'll be able to write something relevant. So it's very rare that you won't know anything about the question. So attempt all the questions. Even if you write one line, now the examiner will give you 1 mark out of 5. Okay. So that adds on, then, rather than getting 0. So attempt all the questions, even if you don't know anything about that question. Okay. Very important, draw diagrams. Okay. So before I continue, be smart. When I say be smart, you need to take advantage of the system. And what is the system? India mein system bahut kharab hai, especially in medical colleges. The external examiner comes, okay, and if you're internal or an external examiner, I've been both. So what happens is that 9 to 5, or actually sometimes 8 to 5, we are taking vivas. At the end of the day, we're so tired, and then we're expected to check 200, 100 or 200 papers and submit them by the next day. So by the time we're so tired, we go to the examination room and start checking the papers. We look for smart answers. We look for answers that are written beautifully, even if the content is not there. And this is the truth. Okay, so write answers. You might write paragraphs and paragraphs and paragraphs of something you know very well. But as an examiner, imagine after asking students why taking vivas out for 8-9 hours, you come and you're not in the mood to read paragraphs. So someone writes the same things in a paragraph form versus someone who writes the same thing in a bullet point or numbering or highlighting and underlining and a very neatly put together answer. I will give the one with paragraphs 3 out of 5, and the one who's written everything neatly 4 out of 5. Okay, so that's how you need to be smart. Take advantage of the tired examiners, okay, and use it to your advantage. Draw diagrams, draw flowcharts, algorithms wherever possible. Okay, drawing diagrams is very easy. In obstetrics and gynae, you get a question on fibroid, draw uterus with a fibroid. You get a question on cervical malignancy, draw a picture of the transformation zone. You get a question on placenta previa, draw the placenta, low-lying placenta. Okay, so make it interactive, make it highlight the important points, draw flow charts, write algorithms, number your answer. So basically organize your answer. That is key. And this is in all subjects, not only obs and gynae. This is in every subject: medicine, surgery, pediatrics. You can do this in every subject. Okay, so tell the examiner that everything is written nicely, okay, and the examiner will give you more marks automatically. Okay, highlight your answers, use different colored pens if you're allowed to. Some colleges don't allow, some colleges do allow. So if you're allowed, highlight your answer. Very important, classify your answer. Okay, if you get a question on, say, complications of preeclampsia, classify your answer. Okay, write maternal complications, fetal complications, neonatal complications. Or if you get a question on risk factors or anything which you can classify. You can classify so many things on antepartum, intrapartum, postpartum, risk factors for postpartum hemorrhage, antepartum risk factors, intrapartum risk factors. Okay, so try to classify your answer. In other words, just make a nice organized answer. Okay, and that itself will fetch you much more marks than simply writing a paragraph. You may be short of time, so when you're making notes, write your notes also in such a form that the answer is well organized. Okay, so topics you can't miss. In obstetrics, these are the topics that you have to study. So when studying right now, if you get overwhelmed by seeing all the chapters in the books, okay, this is what is important. If you're short of time or just maybe a few days before the exam, what you need to concentrate on. You will always get a question on these topics will form 80% of your paper. Okay, most universities I'm talking about. Okay, social obstetrics is very important. Always a question is asked because ours is a developing country. Important social obstetric topics in your area or what you've been taught need to be covered. This I've added this year. Okay, COVID and pregnancy is definitely a possible question, or vaccination and pregnancy is definitely a potential question because it's a hot topic. Okay, so don't miss reading COVID and pregnancy. Okay, that's important. Gynae topics, these are the important topics. Again, 80% of your paper will come from here. Fibroid uterus, adenomyosis, endometriosis, discharge, prolapse. In oncology, the most important is CA cervix and pre-malignant conditions of the cervix. So anything which is prevalent in our country is asked. Contraception will definitely be asked. One or maybe even two questions on contraception does come. Relevant topics in our country will be asked, so don't miss out on revising these topics just before the exam. Okay, coming to the practical and clinical or clinical exam, how do you score well? Okay, so many students fumble here. Okay, so the key to answering well in a clinical exam is to be confident. Okay, even if you don't know the answer, even if you don't know anything, just be confident, be polite, always wish your examiner. Okay, always ask permission. Okay, don't be overconfident, but be confident. Dress well, dress smartly. I'm telling you, these add to the points. If someone doesn't know anything, but is very polite, has a very polite behavior and is appeasing to the examiner, you will definitely find a soft corner in the examiner's heart. Okay, so before coming to the actual exam, how do you prepare for the practical exam? Get a group of friends, form a group, even one other person will do. Okay, and practice the common scenarios that are asked. You can make up cases or take cases in the hospital if that is too time consuming. Make up cases for each case scenario. Write a list of history or important negative history that you're going to ask. Okay, so make notes of each case scenario. Okay, the list of OBS cases and gynae cases. If you get bedside cases, make notes of each of these. Okay, be confident. As I said, when you go to the exam, be confident. Okay, smile and wish the examiner always. And these are points which I have realized both as a student and as an examiner. Okay, so I'm not just making these things up. These things actually matter. All right, always be polite and always answer confidently. Don't fumble with your answers. Answer confidently, dress smartly. Okay, so important points again, don't fumble on basic history and examination. Okay, so as I teach my students in college, when you're 80% of your viva, 80% of students will not go beyond basic examination. All right, you will never reach management unless you're very good. Okay, so most students, we will stop them on history. 50% will reach examination. Only 10% will go beyond examination. It's like that. Okay. So don't fumble on basic history and examination. Okay. Don't fumble on LMP, EDD, parity index, basic things. If you get wrong or if you start fumbling there, okay, it gives a bad impression. Be very confident on your basics. Okay. Same with examination. Don't fumble on basic examination. For example, if one of the common mistakes examiners observe when asked to auscultate the fetal heart rate. Okay, the student will take out the stethoscope and examine with the diaphragm of the stethoscope. That is a basic mistake. That itself tells us that this student has never probably auscultated the fetal heart. Okay, so don't fumble on basic history and examination. Don't miss out important points. Okay, that means, what does this mean? Never in an obs and gynae case, never ever miss breast examination. If you miss breast examination, you're gone. Okay, breast examination, even an antenatal patient, is very, very important. You don't want to miss out on inverted nipple. Don't exaggerate unimportant things. Can someone please mute? Vikas, please mute, please. Okay, don't exaggerate unimportant things. Okay, what I mean to say, you're telling the pulse and you say there is in an obstetric patient, you mentioned about radiofemoral delay. Okay, or you mentioned clubbing in an obstetric patient. The examiner will start asking you questions on coarctation of aorta in pregnancy. Oh, they also want to have fun, right? They also get bored. They then start asking you about causes of clubbing in pregnancy. So don't exaggerate unimportant things. What is important? Pallor is important. Edema is important in pregnancy. Unless you get a patient of heart disease in pregnancy or some bronchial asthma in pregnancy, which again is rare. Okay, don't exaggerate unimportant things, but don't miss out on what is important. Okay, like the breast examination, many of you miss out. I'm giving you common examples. Okay. Always write a summary. So if we have to take 25 vivas in a day, by roll number 10 we are exhausted listening to the full history and examination. From roll number 11 onwards we will say कि सिर्फ summary बताओ. ठीक है, बहुत सारे लोग don't write a summary. Okay, so very, very important, write a summary. After you've written, you get some time outside while waiting for your turn, sit and write a summary. Okay, what does a summary mean? A very brief description of important points in the case. For example, 25-year-old primary gravida with hypertension in pregnancy, admitted at 38 weeks, admitted for delivery. On examination, these are the important points. So just write a brief summary. Don't go on writing, because this happens very frequently. We'll ask you to summarize. You would have written a beautiful history, a beautiful examination, but no one is going to read it. No one is going to even ask you. Okay, all that effort goes to waste. So put in effort in writing a summary, because most of you are going to get asked, again, 60% of you are going to get asked only a summary, because we get so bored of discussing the same history and examination that in the end, summary becomes more important in most of the students. Okay, answer in complete sentences. Don't write. So if someone asks you, what is preeclampsia? The answer we get is hypertension. Okay, or if someone asks us, if I ask you, what is how do we diagnose GDM? You'll say GTT. So don't answer in one word. Explain what is a GTT or what is hypertension in pregnancy. Keep talking till the examiner says, "Ha bas karo." We know that you know the answer. Keep talking. Okay, or answer in complete sentences. Don't give one word. If you say GTT, then I will ask you, okay, which GTT, 75 gram or 100, and then you will get confused. Okay, it's better you say yourself that, sir, we will, or ma'am, we will do a 100-gram GTT where the patient is called fasting, or we'll do 75, whatever you know. Okay, both are done, both can be explained. Or when I ask what is preeclampsia, you say hypertension, then I'll ask you, okay, hypertension in what? How much blood pressure? What else are you going to look for? So it's better you just directly say when the BP is more than 140/90 after 20 weeks of gestation with proteinuria present, that is preeclampsia. I hope you get my point. Okay, so avoid just giving one word answers. Answer in complete sentences. And how does this come? This comes by practicing amongst your friends. After the theory, you have a good 1 week to 10 days of time. And this is for all subjects. Again, not only obs and gynae. Okay. So even if you're unsure, as I said, answer confidently. Okay. So coming to the table viva, how to score well, pelvis and skull, और कुछ भी मत पढ़ के जाओ, pelvis and skull has to be read and practiced in detail. Borrow the pelvis and skull if you don't, most of you wouldn't have it from the department, and sit and practice basic things. We will not ask you show us face delivery or mentor anterior, mentor posterior. We will start with LOA. Even if we start from something complicated like bro or face, eventually if you're not able to answer, we will still ask you what is LOA, and if you're able to show mechanism of labor in LOA, you will get marks. Okay, so don't look for that extra point of face and broad. You need to know mechanism of labor in a basic LOA or a maximum occipito-posterior. Beyond that, it's not important, but you should know pelvis and skull. If nothing else, if you don't get time to study anything else, forget it, but read pelvis and skull. Okay, contraception is another important area. Okay, why? Because as I said, in India, it's a very important topic, contraception, as when you pass out, when you become what the MCI calls IMG, Indian Medical Graduate, these are a few things you have to know. How to prescribe contraception is very important once you clear your MBBS exams. Many times we say pick up any instrument or choose the specimen you want. So pick up something which you are confident in. Okay, usi pe you start fumbling, then we know that this student doesn't know. So just pick up something which you are very confident in, and something which is easy, like a speculum, okay, or a sound. You try and sound where you know nothing much can be asked. Okay, so pick up something which you are confident in. Okay, so I think that ends it. Okay, so if you have any questions, you can ask. Okay, if you're not familiar with case presentations, you can message me, we can discuss, we can plan a session on that. But I wish you all the best for your exams, and I hope this session has helped you. I will put up the recording on YouTube also, and good luck to all of you.